Hello, my name is Whitney Gallagher, and I completed my practice experience at Sivitz Hospice in Squirrel Hill. This location specializes in hospice care for those diagnosed with terminal illnesses. During my time spent at Sivitz, we provided care at facilities and at the patient's home. With Sivitz being a hospice care facility, all patients are accepted to the service with terminal illnesses. Sivitz Hospice also specializes in end-of-life care focused on Jewish values and beliefs, although you do not have to be of the Jewish faith to be admitted to this hospice service. There was a lot of diversity seen in these patients. We went to the Charles Morris Rehabilitation Facility to see these patients on a memory-impaired unit. These patients all had varying levels of orientation. We also went to see patients in their homes. These patients and families were all very diverse. This site is run by the director, my preceptor, Stacy Tablani. She's a BSN RN. The other hospice nurses are all RNs. In the office, there's also a licensed social worker, Nova, and a bereavement counselor, Jan. Anyone can volunteer at Sivitz Hospice. Estee, the volunteer coordinator, trains all volunteers in a training session before they go to visit the patients. Sivitz Hospice has a lot to offer to older adults in the end stages of their life. Being a Jewish hospice, those of the Jewish faith can be cared for with the values and beliefs kept in mind. This can offer relief to both patients and their families. Also, for those diagnosed with a terminal illness, pain management is the key priority of care. Older adults can be cared for with their comfort as the priority in the plan of care. Another reason why older adults would want to receive care is because hospice care focuses on quality of life rather than the active treatment. Sivitz Hospice helps older adults who have decided to stop active treatment and focus on the time that they have left. This is a very important life transition. The counselor, Jan, meets with patients who need guidance. The nurses at Sivitz Hospice also take the time to explain hospice care to the patients and their families. Holistic care is provided at Sivitz Hospice every day. The Jewish-centered service helps ensure the values and beliefs are upheld. This includes ensuring patients have access to kosher foods. There is also a rabbi and chaplain on the service. Jan, the counselor, meets with patients once a week to check in on how they are doing. This service ensures holistic care. At the care facilities, there are bed and chair alarms. This helps prevent falls. Every day, interprofessional teamwork takes place. At 9 a.m., the personnel in the office have a multi-line phone call with the rabbi and the physicians. The nurses also use technology to submit their charting at the end of every day. My project for this practice experience is to complete a document that explains hospice care to the volunteers at this facility. The volunteer coordinator, Estee, asked me to give her some advice from a nurse's perspective for her volunteers. Estee told me a story about how she accidentally unplugged a patient's oxygen machine, and she was distraught, thinking that she had hastened the patient's death. However, the oxygen machine was not sustaining the patient's life. Clearing up little misconceptions like this one can help the volunteers feel more comfortable in the care facilities. My biggest surprise at this site has been switching care from active treatment to maintaining quality of life. I would catch myself wanting to do more for these patients. However, remembering that they are on a hospice services, we do not provide active care treatments. To conclude, I learned a lot about hospice care. I enjoyed viewing care from the values and beliefs of another religion. This has been a wonderful practice experience site. Thank you.